There is a worry that lives quietly in the minds of many men. Most never say it out loud. It rarely comes up in doctor visits. Many men carry it for decades without one true fact about it. That worry is simple. Is my size enough? Does my body match some standard picked up in adolescence? Do women notice, compare, and judge? If that worry sounds familiar, hear this first. You are not unusual. You are not weak. You have almost certainly been misled by old myths, teenage locker rooms, and media that has nothing to do with what women truly want. I am Dr. Amelia Hart, a men's sex therapist with over 10 years helping men rebuild sexual health and confidence with real evidence, not vague comfort. Before we continue, please subscribe and turn on notifications if you have not already. Every week I share honest, evidence-based guidance on sexual and relationship health. Now ask yourself where your worry about size first came from. For most men, it was not a doctor or a study. It was locker room jokes or pornography, neither of which is an honest source of information. Locker room culture in the teen years is a terrible place to learn anything true about bodies. It runs on comparison and the anxiety of young people who know little about real development. Pornography is built for entertainment and profit, not education, and performers sit at the extreme edge of any trait that sells. Comparing yourself to them is like comparing your height to a pro athlete and deciding you are short. These early impressions stick because the teenage brain stores emotional, socially loaded memories with unusual depth. A belief formed at 14 does not vanish just because a grown man later reads that average erect length in clinical studies is about 5 to 5.5 inches. He may accept the fact in his head, while the old fear stays lodged in his gut, untouched by logic. Now the actual research. The largest study of penis size, published in the British Journal of Urology International in 2015, measured over 15,000 men using trained professionals, not self-report. Average erect length came out to roughly 5.2 inches, with 95% of men falling between 3.9 and 6.3 inches. Most men sit near the middle of this normal curve, not at either edge. Pornography, the main reference point for many men, is pulled from the extreme tail of that curve. Meanwhile, studies asking women directly, in private and without pressure, consistently show most who state a preference favor average size. Many say size barely factors into satisfaction at all, and a real share describe larger than average size as uncomfortable rather than more pleasurable. That finding upends the common assumption that bigger is simply better. It is a male guess, not a female reality. When women rank what actually drives satisfaction, size lands far below emotional connection, attentiveness, communication, unhurried foreplay, and feeling genuinely safe and wanted by a partner. These qualities matter more than any single measurement ever could, in study after study. Female anatomy explains why. Most nerve endings tied to pleasure sit in the external genitals and the outer part of the vaginal canal, not deep inside. The clitoris alone holds roughly 8,000 nerve endings near that outer third. Deeper areas hold far fewer nerve endings, so without real arousal first, deep penetration does not create strong pleasure and can even cause discomfort as tissue changes with age. Girth matters slightly more than length to women who state a preference, since it touches more nerve-rich outer walls. Even so, preferred girth still clusters around average. What creates real pleasure is attentive stimulation of nerve-rich areas combined with full arousal, not raw size. This is the part most men were never taught, and it changes everything once understood. Here is something rarely explained. Worry about size does not just hurt confidence, it directly damages performance. Anxious self-monitoring triggers the body's stress response. Cortisol and adrenaline flood in, tightening arteries and cutting blood flow. The very fear of being inadequate creates the physical conditions that make erections harder to achieve, confirming the fear that caused it in the first place. For men over 50, this cycle hits harder, since erection quality is already more sensitive to stress hormones. The fix is not physical, it is mental. It starts with replacing false beliefs with true ones, and shifting focus during intimacy away from self-judgment and toward genuine presence with your partner. Aging brings normal changes, but connection, not physiology, shapes lasting satisfaction most. For men over 50 dating again, The fear that a new partner will judge you is understandable but usually misplaced. Confidence, warmth, and genuine interest in her experience create real attraction. Managing conditions like high blood pressure, diabetes, and sleep apnea matters more for erectile quality than anatomy ever will, and a doctor's visit helps more than any anxious comparison ever could. Here are steps that genuinely help. Take your heart health seriously, since erections depend on blood flow, so exercise and manage blood pressure. Protect your sleep, since hormones depend on it. Manage stress through movement and connection. Talk honestly with your partner about what you both want, since silence breeds more anxiety than truth ever could. Stop comparing your body to pornography's selected extremes. The worry you carry about whether your body is enough has almost nothing to do with your body. It comes from a flawed information world that quietly planted inaccurate beliefs over years of distorted images. Those beliefs can be questioned, tested against real evidence, and with honest work, finally replaced with the truth you deserve to hear all along, starting today.